how worried should we all be about the Omicron variant? It's a little too early to tell what the severity of the new variant is. Scientists will need a couple of weeks to determine this. The public health specialist Professor Jonny Myers co-authored an article in the Daily Maverick explaining what we know so far. Some of the key points are that travel bans are useless, vaccinations are key, and outdoor restrictions should not be considered. Professor Myers joins us now via Zoom to elaborate a bit further. Thanks for your time, Prof. We appreciate it. So you say one of the most important things to do is to be vaccinated. Some will ask why when we still don't know and still need to find out if the current vaccines are going to be effective against the Omicron variant. So, Prof, tell South Africans why you think it's still important to vaccinate.
Well, I think that it's a little bit like investing in the stock market. You can't totally predict what's going to happen, but you can have a pretty good idea what might happen. And I think that every single variant that we've had has been the vaccines have worked in terms of severe illness, hospitalization and death, if not in stopping infections entirely. Or transmission entirely, they have really worked to, in fact, reduce the burden of disease, of severe disease. And I think that we have to operate on that assumption. I think it's a good assumption for now, and if we do that, we will be prepared.
So these mutations are able to evade antibody responses, which actually raise the alarm for countries that impose the travel ban on Southern African countries. Is there good reason for them to panic, though, given that we know so little?
Well, I don't think there's good reason for them to panic. And in particular, we don't... Sorry, I just lost track of your question there. Sorry, could you just repeat that?
So just in terms of the alarm bells being raised because the mutations are able to evade antibody responses, the question is, is it a good reason to panic?
Yeah. Okay, I don't think it's a good reason to panic at all. If you remember, that's how we lost our AstraZeneca vaccines early on, because of that, poor antibody response. So the antibody response is not the most important response. The most important response is the T-cell response, which is the one that's operative in reducing severe disease. That's the important thing. So what it means is that if the antibodies don't work on Omicron, you might get infected more readily, but there's no suggestions thus far that you would have a more severe disease course if you're after infection.
All right, let's talk about the president's next move for South Africa. And, of course, restrictions is what I'm looking at here. You have said that a blanket restriction of the use of beaches and parks would be counterproductive. How so?
Well, I think, if you remember from the very hard lockdown, I'm certainly speaking from a Cape Town point of view where we have lots of beaches and promenades where you can walk along. These were all banned. And that's just crazy because you then are confining people indoors. And especially if people are, there's a lot of crowding happening indoors, which there often is, and the lower down the social strata you go, the more crowding you're going to get. You don't want to force people indoors and in hot weather conditions. So you want to encourage them to get out and to be in the open air wherever that can be. Obviously, you don't want to have millions of people on a small piece of beach somewhere, and that's something that could be controlled. But if people want to go into Table Mountain, it should be possible. It shouldn't be shut. The parks shouldn't be shut. So that's really what we were meaning. And also for those people who want to be in restaurants and they want to go out and eat, outdoor seating would be just fine, no problem. It's the indoor seating that's the problem.
I totally get that, right? But as you say, you could have hundreds of people on one small beach in Clifton, for instance, all touching the same ice cream man's little container to buy ice cream. What's the reality and possibility of actually getting the virus by doing things like that, or going to a restaurant, using utensils, same tables, etc.?
Well, I think that, a lot of the sanitization is you may call it theatre to some extent. But this is really an aerosol spread infection. And if you think about, most of the restaurants, they will sanitize religiously. People leave the table, everything gets swiped with alcohol. I'm sure the utensils are fine, they've been washed. I don't think that's a problem.
Yeah.
I think to eat outside is really pretty harmless.
And then let me ask you one question about the Rage Festival. It looks set to continue, or start tomorrow actually, but it's only for those who are fully vaccinated. Do you think that's a wise move?
Well, I think that it's not a particularly wise move, because I think that is something that where people will be crowding together in perhaps small spaces, indoor spaces, to some extent, perhaps to some significant extent. And it seems to me that it's really a situation where you're going to have a lot of spread of infection. Now, the really important point is that being vaccinated is not really any guarantee that you won't get infected or that you won't spread the infection to somebody else. There's a very important message. It doesn't mean that vaccination doesn't work. It does, of course, work very well. And people need to get vaccinated, and particularly those who are vulnerable, the elderly, those with comorbidities like cancer or immune system disorders. That must happen, and that must happen now. But for young people congregating together, even though they're vaccinated, they would be, in fact, quite able to be infected and also to transmit that infection. And it's to themselves and to other people. So I think they won't transmit in the same way, to the same extent as unvaccinated people, but there is that risk, especially where there are large crowds of people congregating. So I would say, as the President said last night, we want to avoid mass gatherings. And I think that's really important, because we don't know anything, we don't know enough about this Omicron to really say, oh no, it's going to be safe because people are vaccinated. Just last week, a whole lot of vaccinated people went on KLM to the Netherlands, and 9% of them turned out to be positive. They were vaccinated but not tested before their flight. So I think that makes the point.